On behalf of the Women's Health Task Force, I want to welcome everyone and thank you all so much for coming out here over your noon hour to support contraceptive coverage for U of I employees. My name is Brooke Anderson and I'm an organizer with the Champaign County Healthcare Consumers, and we are a member of the Women's Health Task Force that is leading this campaign. Thank you all for coming out to this event to kick off our campaign to win contraceptive coverage for U of I employees. This event is the first major step in building a movement to win full contraceptive coverage. And we want to use today's meeting to talk about this campaign and how you personally can get involved in this effort, and why we are confident that with your involvement and your support, we can win contraceptive coverage for U of I employees. Now, a lot of work has already been done by individuals and organizations involved in the Women's Health Task Force. And I'd like to take a moment to acknowledge those individuals and organizations. So the following members of the Women's Health Task Force have been working for the past few months on this campaign. I'd like to acknowledge them and see if they could stand when I announce their name. The first one is Jenny Mueller, who is doing an interview out in the hall. But Jenny's put in a lot of hard work, and she was the driving force behind the establishment of this task force. Kathy Spiegel from Planned Parenthood of East Central Illinois. Claudia Lenhoff of the Champaign County Healthcare Consumers, Nicole Buchanan of the University of Illinois, and Margie Skirvin of Champaign County National Organization for Women, peeking out of the door from the side of the table. So in addition to Champaign County Healthcare Consumers, Planned Parenthood, and Champaign County Now that form the core of the Women's Health Task Force, there have also been other organizations that really supported this campaign or have officially signed on or passed a resolution supportive of this effort. And those organizations are, and if you're with one of those organizations, feel free to stand up or wave to show everyone that you're here, the 85% Coalition, Campus for Choice. And Campus for Choice did amazing amounts of publicity for us, and Shannon in particular did a lot to help this effort. Feminist Majority, the Illinois Disciples Foundation, the Progressive Resource Action Cooperative, the Union of Professional Employees, and the Women's Direct Action Collective, which takes up the whole front row. So next I'd like to go ahead and get started with the second item on your agenda and briefly explain to you the issue of employee rights as it relates to contraceptive coverage. Almost 1/2 of all pregnancies in the United States are unintended. Of these unintended pregnancies, more than half end in abortion. Contraceptives have been proven to enhance the health of women and children and prevent unintended pregnancies and reduce the need for abortion. So clearly, contraception is integral to women's health. However, right now at the University of Illinois, contraceptives are excluded from the employees' health insurance plans, costing many women employees between $300 and $500 per year. This lack of contraceptive coverage and the high out-of-pocket costs are major barriers to contraceptive access for women. Contraceptive coverage is not just the responsibility of insurance providers. Rather, employers have the responsibility to provide coverage that meets the needs of their employees. This fact was recently confirmed by the Equal Employment Opportunities Commission in their landmark decision of December 2000, when they ruled that an employer health plan that covers preventative health services, a failure to provide full contraceptive coverage under that type of plan represents discrimination against women under Title VII of the Civil Rights Act of 1964. And then following this EEOC decision, Planned Parenthood Federation of America and other organizations have been forming coalitions, like us, to support women's efforts across the nation to gain contraceptive coverage for employees. And since that time, several employees have successfully sued their employers, and states have held up these employee rights. For instance, in June 2000, a federal district court in Seattle ruled in the case of Erickson versus Bartell Drug Company that employers' exclusion of prescription contraception from a health plan that covers other prescription drugs and devices is sex discrimination in violation of federal law. Now, of course, all of us women who have been paying this type of money every month, every year, we didn't need the federal court to tell us that the fact that they don't cover contraceptions is discrimination against women. We know that. We've known this for a long time. but to categorically refuse to provide coverage for contraception when it's so central to women's health, and not only to women's health, but women's financial well-being, this is discrimination. Out-of-pocket expenses add up quickly over a lifetime and greatly contribute to the fact that women, who are still making less than their male counterparts at most jobs, pay 68% more than men for out-of-pocket healthcare expenses. So we're here today to say that as the state's flagship institution of higher education, the university should take a leading role in providing full contraceptive coverage for its employees. The U of I should meet with the Women's Health Task Force and talk about a timeline and a strategy for establishing this type of contraceptive coverage. And more than that, the university should be taking a leading role in the state, going to the state and making sure that they cover it for all their employees, not just here at the University of Illinois. That's a brief introduction to the issue, and I'd like to introduce you to some folks who are going to give you a lot more detailed information on the issue. So first, I'd like to introduce you to Claudia Lenhoff. Claudia is the director of the Champaign County Healthcare Consumers, and she's going to talk about consumers and employees organizing together for change. Claudia.
Thank you. I just want to tell you very briefly a little bit about Champaign County Healthcare Consumers and why we're so proud to be part of this effort. The Champaign County Healthcare Consumers is a 24-year-old grassroots citizen action organization, and one of the fundamental aspects of our mission is that we work to give consumers a voice in the healthcare system. And we believe that consumers have to have a voice in the healthcare system because otherwise nobody else in the healthcare system is going to be working to protect your interests. And that's what we're talking about doing here today. The people who are most directly affected by their health benefits are organizing to make sure that their employer ends the discriminatory practice of not providing contraceptive coverage. In our experience over the past 24 years and our many victories, we know that it's consumers and the people who are most affected who lead the charge for meaningful change and who help bring others along, whether it's us bringing the U of I along and hopefully the whole state of Illinois. Healthcare Consumers is very proud to be a part of this effort and to be part of the Women's Health Task Force. For years, we have been getting calls from U of I employees asking why they are not provided with contraceptive coverage. And so we're very glad to be part of the movement that will put an end to this discrimination and make that coverage available. There is absolutely no medical or financial reason to deny this coverage. Be prepared, because you will hear arguments about the cost of providing this coverage and how it's not financially feasible. We all should understand that this issue is not about cost. It's about discrimination and employees' rights and employers' obligations, and it's about basic health care. But if we are to consider the cost argument, you will hear and read the facts that we are providing, which show that it is actually very cost-effective for employers to provide this coverage. It is certainly cheaper to provide this coverage than it is to cover pregnancy and delivery, health complications resulting from pregnancy and delivery, or fertility treatments, or Viagra. And in all fairness, who has greater resources to absorb the cost of the coverage or the lack of the coverage? Right now, it's women employees paying far greater out-of-pocket costs than it would cost the state to implement this coverage. You are right to fight for this, and we will support you every step of the way. But don't get bogged down in misleading arguments about cost or other such issues. We need to be very clear about this. This campaign is about ending gender-based discrimination, which affects women's health and financial lives, and it's about employers' obligations to provide this health coverage. The writing is on the wall. This change will have to come, and you'll hear a little bit more about that later, about the things that are happening nationally. And you will see the writing is on the wall, and I think the U of I recognizes this as well. But rather than fighting the U of I or ignoring, this change will have to come. And rather than fighting it or ignoring the needs of the employees, what we're asking is for the U of I to do the right thing and to provide this coverage. We're asking them to work with us in developing a plan and a timeline for implementing this coverage and ending this discrimination. Don't let them pass the buck on this issue and wash their hands of their responsibility. If they join with us, we are all more likely to succeed, and this is an effort that they can then be proud of. And this change at the U of I could go hand in hand with changing discriminatory policies that affect all state employees. We will succeed. I'm very certain of that. It is a matter of time and how well organized we are. This campaign could last 6 weeks or it could take a year. We don't know. We do know that nothing is ever won in a day or through a single action. And we also know that if we give up and do nothing, we'll just have more of the same. Let me wrap up by saying that the U of I could already have been pushing for change on this issue and showing leadership. And there have been some efforts recently. The Faculty Senate has a Faculty Benefits Committee, and they have let the U of I know, and they have let the state know that they're also interested in looking into this issue. That was in April of 2001. But the real energy, the real power is going to come from you and from us together. Healthcare consumers, along with Planned Parenthood, Champaign County Now, and all the other organizations that Brooke mentioned, will continue to support this effort. And this victory could mean a victory for the entire state of Illinois, for women, employees, and consumers. Thank you.
Next, I want to introduce to you Jenny Mueller. Jenny Mueller's personal struggle to have her pills covered was sort of the driving impetus behind us forming the Women's Health Task Force. I know it's energized all of us, and it's her struggle that's the reason we're all here today talking about contraceptive for all U of I employees. Jenny.
Good afternoon. My name is Jenny Mueller. I am a U of I staff person. In June of 2000, I was diagnosed with endometriosis, which is a disorder of the reproductive system. And the most effective treatment for this disorder is to use contraceptive medication. That's what my doctor told me. There are other possibilities. It's the most least expensive and the most effective treatment. So you can imagine my surprise when I found out that my health care coverage does not cover contraceptive, even when you need it for medical necessity. It seemed very unfair to me. It seemed very discriminatory, given that this is a woman's disorder, that they could actually deny medication that I need to treat my disorder, medication that will hasten what is a chronic condition. And so I figured that I needed to do something, and I just didn't know what to do. And I, by chance, came across a little blurb in the DI about the Champaign County healthcare consumers, and I thought, well, maybe they can help me with this. And so I contacted their hotline, and we've been working together ever since that time. But initially what they did was help me develop a strategy for appealing my situation. This involved appealing several different agencies, going back and forth over many different months, and it literally took over a year to finally get them to cover what they should have been covering all along. They actually had the HMO change their policy to allow coverage of contraceptive drugs for medical purposes. But again, it's not going to be covered if you need it for any other reason. I don't think anybody should have to go through what I went through. I'm not saying it was such a tremendous burden on me, but it was an awful lot of managing and micromanaging to get to what should have been there to begin with. A lot of people will not know who to talk to, will not know that there are resources out there, will not have the energy to go through the process of appealing that you really do need to go through, and it is a lot of back and forth with a lot of different people, and some people are just not going to go about that because it's just too much for them. So I really don't want anybody else to have to go through that. To get something that which should so obviously be a coverage of their health coverage, something that they pay for every single month with the expectation that they will get what they need. I don't think it should matter whether you need your contraceptives for medical purposes or for contraceptive purposes. It's discrimination not to use them. Sometimes people need them for both. And when you start splintering arguments that way, you get into a lot more red tape. So we really need to fight for contraceptive coverage overall. I think that the discrimination against women in the employee health coverage system was really brought home to me by the fact that I am a woman, and only a woman would need this contraceptive drug for contraceptive or medical purposes. And I could not get my medication covered, and that is unacceptable as far as I'm concerned. I know that a lot of other U of I employees are going through this as well, so I know that mine is not an isolated case. In my very small office alone, I know of 2 other conversations I had with individuals involving very similar cases. So if you take my office and multiply it by the many, many offices that are on this campus, we're talking about a very large number of affected people. If I can fight to achieve my rights over a year, then I think that, you can imagine what we could all do if we banded together, and that's really the goal of what we're doing today. We have a small core group of people right now that are willing to fight for this, so what we're looking for is more people to join in that and hasten the time it takes for us to get our coverage. So I look forward to working with every one of you as we progress in this issue. Thank you.
Next, I want to introduce to you Kathy Spiegel with Planned Parenthood of East Central Illinois. And Kathy's going to be telling us about how the women across the United States are looking and watching our struggle and what kind of national support exists for our campaign. Kathy.
I'm sorry, I have a little cold this morning, so I sound a little low. Brooke's already given you a little bit of a rundown on some of the successes that we've had. By working with other coalitions in the states, we've been able to have a lot of impact on this issue. We found out Monday morning that the University of Utah finally has agreed to provide contraceptive coverage, and they started out the same way we did, making small waves, making bigger waves, constantly, waves wear away the soil. And enough people spoke up, and they finally decided that it was the right thing to do. Working with organizations in states like Washington was extremely successful. The EEOC suit, which led to then the state of Washington actually passing legislation saying that any insurance coverage that covers prescriptions must also include contraceptive coverage. That's the ultimate, because then no one has to fight this battle alone, and we don't have to fight it in isolated pockets. We are prepared to offer legal counsel to anyone who would work with us to file an EEOC suit against the University of Illinois. They know this is a possibility. They've already alluded to it. What they're saying is we are doing everything we have to do legally. So what they're waiting for is for something else to change. If there are 4 or 5 women who would be willing to band together, we will provide the counsel. It will not be any out-of-pocket expense for you, and we will guide you through the process to file that suit. However, that's a 6 to 9 month process for it to go into the hearing, and then for them to make a ruling. If that's something that you think you'd like to be on the ground floor on, see me before you leave. I'll provide you with the information, and then you can make that decision if that's something you'd like to do. The other action that I want to talk about has to do with what's going on legislatively in the state. Last year, Planned Parenthood crafted a proposal that passed the House, and it says exactly that any coverage that includes prescription coverage must also include all contraceptives. It passed the House with no problem, went to the Senate. It's sitting there waiting for it to be called for a vote. Senator Weaver will not call it to the floor because he knows it's going to pass. There's a petition that's being circulated right now I would like for you to put your name on if you are a voter, or even if you're in this county and you can be a registered voter. We want them to call that. If the Senate passes, it will become state law. Then all of us that have prescription coverage will have to have contraceptive coverage. So we're fighting it on 2 fronts. We're doing it locally, trying to make an impact here, because if we can do it at the University of Illinois, then we hope that it will bleed over to other employees at the U of I. At the same time, we're pushing it legislatively so that the whole state will be affected. So these are 2 things that you can do. Those of you that picked up the pink and brown buttons that say Cover My Pills, that is a website that tells you other things that you can do to help move this action forward. It's a nationally run website that is kept active by Planned Parenthood, and you can get the latest information on that. You can log on to that at any time. If you want to know how things are going, you can always call Planned Parenthood. You can call Healthcare Consumers. We're working together, keeping each other apprised of what we're doing. We're just kind of working on different fronts, but we're in it together. And all of us, men and women, because when your partner who is female is not getting contraceptive coverage, it affects you too, because it is an expensive project to take that out of your pocket. And getting pregnant and not wanting to be pregnant forces you to make some decisions that may not be something you want to look at. So that's why we're so adamant that this be covered. Thanks so much.
Next, I want to share with you the University university's administration's response to requests for contraceptive coverage for employees here at the University of Illinois, because I know many of you are thinking, well, what has the university said? Why don't we have coverage yet? So I want to share with you the kinds of communications we've had so far. The Women's Health Task Force contacted the U of I to ask for their support and direction on this issue. Jenny, from whom you'd heard earlier, has been in communication with the Director of the Benefits Office and with the new Chancellor, Dr. Nancy Cantor. The Benefits Office was helpful in explaining that coverage decisions are made by Central Management Services at the state level. The U of I Benefits Office has been in contact with CMS, Central Management Services, and CMS has informed the Benefits Office that they feel that they are in compliance with the law right now and are therefore not obligated to offer this coverage. We've also contacted Dr. Nancy Cantor and invited her to be here today. She let us know that she had a prior engagement and could not be with us today, but that she will look into the way that decisions about these matters are made, both here and at the state level, and will investigate the way in which we as a campus might provide input into the choices that are made available to U of I employees. But we feel that is not enough. The university needs to do more to actively work with us to implement this coverage as soon as possible. Whether this decision is made at the U of I, whether this is a decision that the U of I can make independently, or whether this is a decision that needs to be made at the state level. Either way, the U of I needs to act to provide contraceptive coverage. And they shouldn't just do so on their own. They need to be working with U of I employees, with Planned Parenthood, and with Champaign County healthcare consumers, and all the folks that comprise the Women's Health Task Force. We want to sit down and talk this out with them and talk about a timeline and a strategy and to try to work together on this. And beyond trying to establish contraceptive coverage for just U of I employees, we need to push for this at the state level. The University of employees comprise a huge chunk of all the different employees in the state that are covered under these insurance plans. And so the U of I has plenty of leverage that they can throw behind this campaign if they will begin the discussion with us and start to move on this issue. But obviously, we know that institutions like the University of Illinois always take a little prodding to get them to move into the right direction. And so we need to immediately communicate with the university, communicate to the university the groundswell of support that exists from university employees and from community members and across the nation for this type of coverage. And so next I want to introduce to you Nicole Buchanan of the University of Illinois, and she is going to let you know how you personally can make your voice heard on this issue. Nicole.
I guess first of all I want to say that I'm just so very pleased to see such a large group and such a diverse group of people here, men and women, all races. This is truly a universal issue. And you know what? It's time to tell the university to cover our pills, cover our depot, cover our diaphragms, and any other various form of contraception we need. And here's how you can help. You can join with us by calling on the university to end the discrimination and provide contraceptive coverage. You can help us by taking one of these postcards, filling them out right now today, and giving them back to us before you leave. These postcards will tell the university that we want them to do whatever it takes to make contraceptive coverage available to all employees. And we want them to meet with us to discuss how we can make this happen and how this can happen as soon as possible. We're also asking the U of I to meet with us because we want to be part of this process. We want to learn what it takes, and we want to contribute our energy to making sure that the process for getting contraceptive coverage moves forward. And we think that by working together, we can make a victory that not only the university can be proud of, but all of us can be proud of. We can't just leave it to the university to protect our best interests. Unfortunately, we just can't do that. We have to get involved. Now, as Claudia said earlier, it's the people that are most affected by an issue that are the people that are able to charge forward and make a change for the improvements in healthcare. You've already helped us out by being here today. Now we want you to take that next step. Sign the postcards, and we want to flood the university with these postcards. That's our goal. You can also take extra postcards and distribute them to everyone in your office, friends, family, coworkers, and anyone else you can think of that might be interested. We all need to remember that no struggle is won in one day, nor is it won with one effort or one action. We need you to stay involved to make this campaign work and to make it happen as quickly as possible. Now, you can do this also by making sure that you've signed in today so that we can contact you with information and notify you on the campaign and how this is going. We can also let you know about other events, actions, and opportunities that can help this move forward. You can also help out by planning to attend our next meeting of the Women's Health Task Force. This will be held on Tuesday, December 4th at 6 p.m. That was Tuesday, December 4th at 6 p.m. at the Champaign County Healthcare Consumers Office. We also need your help by reaching out to more U of I employees so that we can spread the word and let them know what is going on and how they can get involved. Tell your friends, your coworkers about this effort. Give them these postcards. Ask them to return them to us. Take our other campaign goodies that are out in the front and spread the word. Let people know what we're fighting for, why it's important, and if you can, get them to our next meeting. Finally, while we are focusing most of our efforts on the U of I, we want them to be forerunners in leading this campaign to provide contraceptive coverage for all women. We are also fighting this struggle on many different fronts, and you've heard a little bit about that today. As you've learned today, we are exploring the possibilities of class action lawsuit, as well as advocating for state legislation that would force insurance companies to provide contraceptive coverage. Now, you can help with this legislative effort today. You can do that by signing the petition that's been going around. This will be an effort to bring this to the floor. And if you have any questions about the class action lawsuit, please contact Kathy at Planned Parenthood to find out more information about that. And again, just get involved. In any way, in any manner, we will appreciate your help. Now for questions and answers, I'm going to turn it back over to Brooke.
One last thing I wanted to plug by way of ways to get involved or help out with this campaign. I know as I look out into the room, I'm looking at who I see here, and so many people are involved in 4 or 5 other organizations. They're working for change on so many levels. There's only so much time that everyone has. So while we appreciate you being here and also attending Women's Health Task Force meetings and whatnot, if the only way that you can contribute is to make a small donation to the Women's Health Task Force, that's something we would accept with very gratefully. It takes a lot of money to put out the bulk mailings that we do and to do the kind of outreach that brought all of you here today. And I know, at least for a lot of the women that I've talked to who have donated, they've said, what an investment when I'm paying $30 a month right now, and there's the possibility within the next year, if we work together to have our pills covered. It's a great investment for me to give a little bit of money. So if there's any way people could chip in, I would appreciate that. And next, we'd like to take questions, and feel free to ask questions of anyone here on our panel. Yes?
Yeah, I was listening to Ms. Spiegel, and you said there was a bill crafted.
Yes, Senate Bill 18.
Senate Bill 18.
Yes.
And what is the problem that you're having specifically?
Senator Weaver will not call it to the floor for a vote. It sat through the whole session last spring, ready to be called for a vote. He controls which things come up for a vote by the senators. It's already passed the House.
Did he give you any explanation as to why he will not call?
No, he doesn't. When you send a note to him, he will not come to the door. We've gone over on legislative days and tried to talk to him. He just will not come to the door.
Is there any way can the...
You can call his office, certainly, and let him know that you want him to call that up for a vote. You can send letters, you can sign the petition that's going around. Yes, go to covermypills.org, and there's a sample letter there also. But the legislation has already been crafted, and it's already passed the House. It's sitting there waiting to be called. We have the votes to pass it. We just need it to be brought to the floor.
Other questions?
What's the name of the bill?
Senate Bill 18.
Yes. Isn't that put off to like bombard him with more and more letters just saying like...
Absolutely. Phone calls are wonderful.
Okay. And can we get that?
It's 367-0009.
Thank you.
Other questions? Yes.
Jenny Miller, she said something about
my HMO decided that the university had nothing to do with it. And actually, I had written the benefits center several times and received no response on how I should go about, appealing this. There's a list of things that it covers. I don't think it covers clear skin. Do you remember the list?
I think one of the issues is, Jenny's struggle was over something that should have already been part of any HMO or any insurance coverage. And I think, one of the aspects that relates to this is that we at the Healthcare Consumers, whenever an employee is having a problem with their health benefits that they get through their employer, one of the avenues for getting some action is by going to the employer who helps pay for these health benefits and saying, listen, this company that you have to cover my health care needs isn't responding very well. And, part of the problem that Jenny had was she couldn't get the backing of the U of I Benefits Center to help her in her struggle, and a struggle she should never have been having. And that's part of why we're saying, we all need to be involved in this effort to add this coverage for the contraceptives, because if we rely on the Benefits Center, and I'm not trying to be nasty or say anything bad about the Benefits Center, but if we rely on other people beyond, ourselves, we can just sit around all the time. The only reason Jenny had a victory is because she did an extraordinary amount of work. But that should have been covered, and in the list of, what they cover or don't cover, it is very strange, and so it's just better for all of us if contraceptives are covered, period, regardless of the reason that you're using it.
And if I can add, and correct me if I'm wrong, another part of that is that they limited which types of pills are covered. So if that formulary doesn't work or is having side effects and they recommend another one, if that one's not covered, we're back to square one.
And just real quick too, one other thing, there are health conditions that are not reproductive health conditions for which women have to avoid pregnancy. There are other kinds of physical health circumstances where a pregnancy would jeopardize their health and their lives. But if they go and try to get contraceptive coverage, if their cardiologist or whoever else isn't saying this is for medical purposes, I think Jenny said it very well. If we start splintering it and dividing it and trying to figure it out, it's unwieldy and it's unfair and it's not right. And so there's a lot of circumstances that, if we just get this coverage, our lives would be so much better.
Meredith?
What forms of contraception would be covered? And
All.
all,
That's
So
what we want.
we don't want any discrimination. We should say all contraception.
and what types of employees? Like all employees in all departments? I mean, is there any differentiation among which employees are covered?
Yeah, right now it'd be faculty and staff, academic professionals, and obviously when the GEO gets recognized, graduate employees. Julia?
If it goes through the state, it's not an issue. Everyone will be covered.
Julia?
I just want to be clear, you said Viagra was covered by University of Illinois?
I'm unclear about whether or not Viagra is actually covered under, I'm seeing heads nod in the back, so I take that as confirmation. One of the things we do know is that after 2 months of being on the market, Viagra was covered by half of all insurance plans, whereas right now, only a third of insurance plans nationwide cover the pill, and only 15% cover all 6 major methods of contraception. Any other? Paulette's holding up the petition if anyone hasn't signed it yet. Do we have any more questions? No? Well, thank you all for being here today. If you have questions you didn't feel like asking during the Q&A, please feel free to ask any one of us up here. Please sign your postcards, make sure you're on the sign-up sheet, and talk to Kathy Spiegel if you're interested in getting involved in the legal avenue. And thank you so much for being here today. Take care.